It is health time, so take out your health books. We're going to be on page 74, but we're going to review your comprehension check from page 73 from last week. But this is in preparation too for your test. There will be a health test on Thursday. I know it sounds weird, like, wait, Thursday, but you know, we're home, we're able to kind of be studying through, so you'll have a chance to study, you know, today, obviously, but then we'll have review for the next couple of days, and then that health test will be on Thursday. And it'll be over pages 55 through 78. So all of the things that we've been talking about with the proper care for refrigerating our food and taking care of the symptoms that we might have for when we get sick, what a diagnosis is, viruses and bacteria, how to take care of ourselves, making sure that we're taking care of our hair and our teeth and our eyes and our ears, what not to put in, and you know, how they can protect themselves. And then the everyday health habits, you know, not just touching everything and being more careful and washing our hands before we eat, and all of those things that we've gone through the past few days. That's what we're going to be having our test over. So just go back, review, and go through those. I think you'll be able to do just fine if you're reviewing those carefully. But page 73, I want to do the comprehension check really quickly before we go on. Number one, your primary teeth are also called your baby teeth, are also called your primary teeth. Very good. Yes, that's what I was planning to do. Yes, primaries. Yes. Number two, your adult teeth are also called your permanent teeth. Good. Small holes in your teeth, those are cavities. What is a sticky film that forms on and between your teeth? That is plaque. Excellent. If you stick anything in your ear, you could damage what? Your eardrum. Yes, you could damage your eardrum. So that's why you have to be careful. You know, it's best to just put a soft cloth with warm water, and that's it. To help protect yourself from, you should wash your hands before you eat. From germs, obviously, yes, from germs. So we protect ourselves from germs by washing our hands. All right, so page 74, terms to remember. The first one is first aid. That's where we are today, first aid to the rescue. So the help that is given immediately after someone has been hurt, the first aid that is given to them, it's called first aid. Minor injuries, injuries that do not require an immediate doctor's visit. And then first aid emergencies are injuries that do require an immediate doctor's visit. It's something very serious. Then the Heimlich maneuver, pulling in and up on the abdomen to remove an object that causes choking. So let's find out about first aid to the rescue. When someone gets hurt, it is important to know what to do to help, because doing the wrong thing for an injury can cause more damage. So you really have to be careful. We think that we're helping when we try to help somebody get up or do certain things, but many times that could be worse. So we need to understand at least some basics of what to do if somebody's been hurt, so we're not making it worse. The help that is given immediately after someone has been hurt is called first aid. What is first aid? Help that's given immediately. It's the first aid to that person, okay? It helps to make the injured person more comfortable. It can also prevent infection. If given immediately, first aid may even save a person's life. Until you are older, you will not be able to do much to help someone with a serious injury, but you can get help and quickly. So one of the things that you could do is, you're not going to maybe be able to do the CPR on somebody, like you're not strong enough necessarily to do CPR on an adult, but if you can run and get help quickly, that could be helping to save their lives as well. Or calling 911. 911 is the number to call for an emergency, not just for random, talking or whatever. I know time on the videos. I wish it was school so I could just tell you this different stories, but just really quickly, there was a story that I heard a couple years ago where a little boy called 911 because he was having problems with his math. And he was very upset because he couldn't get the math problem right. And, but that it was not it's not funny in that sense that, because he really shouldn't have tied that up, because what if there was somebody having a heart attack or somebody choking or somebody dying and he's tying up the phone. So that's why we don't use 911 for anything other than a true emergency. We don't call and say, I'm struggling with my math. The operator was very nice to him, but had to say, this is not to be used for this. This is very dangerous that you did this and whatever. Plus you could get in trouble now. Police don't take that lightly. So don't call it for anything other than an emergency. Find someone with a telephone who can quickly call for help. There are some injuries that you can learn to take care of. Minor injuries are injuries that do not require an immediate doctor's visit. An injury that is not cared for properly can become a serious injury if it becomes infected. And here are the signs of infection. If the skin around the wound becomes red and tender, so wherever you got cut or hurt, if it's red and tender, that's when you know that there's infection. There may be swelling around the wound. Sometimes pus forms in the wound. Those are all signs of infection. So that helps you to kind of be aware. Oh, I think this might be infected. Mom, could you please look at it and see what we should do? For minor injuries, you need rice. Wait, what? Yeah, it's not really rice that you need. It's just something, an acronym. They're called acronyms that will help you. And you can see it at the top of your page there, but I wanted to go through it again. So bumps and twists are minor injuries. If you were to fall and twist your ankle or bump your leg, you should be able to care for it at home without having to go see a doctor. For a bump or twist, simply rest the hurt area. So you just want to rest wherever you got hurt. Then apply ice. So I is ice for rice. Then the next thing is to wrap or compress the area. And that's one of the things that's important to do. Get, medical tape wrap so that you can wrap it around that area, and you don't want it super tight, but you do want to be able to compress it so that it can help the swelling to stop. The ice will do that as well, but compression is also important. And the last thing is elevation. And that is to elevate or raise the hurt area above your heart. So if you can remember rice when you have a minor injury for when you get hurt, that will help. Rest, ice, compression, elevation. What is it? Rest, ice, compression, elevation. What is it? Rest, ice, compression, elevation. That will help you with sorry, I keep putting my hand in your face. Sorry. And they're a little ashy too. But anyway, so those are the 4 things that you can remember. I'm going to rest my ankle that I got hurt. I'm going to put some ice on it. And I'm going to try to, put a wrap on it if I can. Have mom or dad do that, not you. And then I'm going to elevate it above my heart. It doesn't need to be sticking straight up, but it needs to be above your heart. I know that there were times where I would hurt my thumb or something and they said, raise it above your heart. So, as long as it's here, it doesn't have to be like, as long as it's above your heart, that's going to help that swelling. For example, if you hurt your ankle, you would lie down, prop your ankle up on pillows so that it would be above your heart. So if you're laying back and your ankle is up here, then it is above your heart, okay? When blood flows away from the ankle, the swelling will go down. So that's why we do that. It's important. Applying ice also helps reduce swelling. It is important that you rest the hurt area to give it time to heal. If you do not, you will end up causing the injury to get worse. Small scrapes and cuts are also minor injuries. If the wound is big or bleeding heavily, find a trusted adult or call 911. For small scrapes and cuts, clean the area with soap and water, hold a clean cloth tightly over the injury, and raise it above your heart. Okay, just above your heart. Doesn't have to be, like I said, way up in the air, but above your heart. This will help keep the bleeding to stop, But then do not keep checking to see if the bleeding has stopped. That's one of the things that you guys have the hardest time with. Oh, it's still bleeding. Miss Monroe, it's still bleeding. No, you have to keep it there, hold it above your heart and leave it there and try not to keep checking. That's the same thing with our bloody noses. We're like, oh, it's been 5 minutes, right? No, it's only been 2 seconds. So you have to hold it for a while. Don't try to keep checking to see if it stopped. This will cause it to bleed again. Once you believe the bleeding has stopped, wet that cloth and then gently pull it off. Use a bandage to cover the injury and to prevent infection, because you don't want anything getting in there. Remember, breaks in skin allow germs to get in. I just made a rhyme. Breaks in skin allow germs to get in. Okay, anyway, technology tip. Most cell phones are locked with a password to keep unwanted people out. So what happens when you need to call 911 and you can't get in to your phone because it's locked? On most smartphones, there is an emergency button on the screen where the owner would put in the password. Simply press that emergency button and then you can dial 911 without having to worry about a password. Emergencies. A first aid emergency requires immediate help from a doctor. So when it's a first aid emergency, it means doctor needs to be contacted and help needs to be given. Have you ever been playing outside when a friend fell off a slide or something tall? If you think he might have injured his head or neck or broken a bone, do not move him or try to help him up. Don't do that, because you could make that broken bone or head injury or back injury or whatever worse, neck injury worse, because you tried to move them, okay? There are some broken bones that might be simple fractures and they're just clean and then they won't break through the skin, but then if you move them, that bone might crack up through the skin and that could be a worse injury, causing a lot more problems. So don't try to move them. Don't try to help them up. Step back and see if he gets up on his own. If he does not, then find an adult and call 911. A seizure can cause someone to lose control of his body. The person may fall on the ground and his arms and legs may move. If this happens, just try to remove everything from around that person that might be near them, so that he does not hurt himself. But you stand back. Don't hover over. You move back and you move anything around them that might be in the way so that they don't get hurt. Sometimes a seizure is a first aid emergency. Find an adult and call 911. Choking is another first aid emergency. When someone is choking, he's not able to breathe. Okay, he can't talk, he can't even cough. Okay, so if a person is truly choking, they're basically will have their hands around their neck and nothing is coming out. If this happens, find an adult and call 911. The adult will stand behind the choking person and wrap his hands around the person's waist while making a fist right at the person's belly button, He then will pull in and up, forcing whatever the person was choking on to come out. If that does not work, the adult, may have the person lean over and hit the person's back very hard to help that item move and come out. This is called the Heimlich maneuver. The Heimlich maneuver should never be done on someone who is not choking. Don't do it for fun to test it on your friend. Don't do that. It's very dangerous. It's only for emergencies, okay? Electrical shock is a first aid emergency that is caused by electricity. You have probably been told not to play outside during a thunderstorm. You should also be careful when using electrical devices near water or plugging them into electrical outlets. We don't often think, oh, my hands are wet, I'm just going to plug it in. That's dangerous. Electricity and water should not be together, mixing. So you want to make sure that you dry your hands and that you're not plugging things in where it's wet or in a wet area. That could be causing problems. Following these warnings will help keep you safe from an electrical shock. When someone has had an electrical shock, it is important to remember, don't touch them. Do not touch somebody who is, if they're, oh, it hurts, help me. You can't. You have to maybe talk them through it. But if you touch them, then it can transfer and that could cause you to be having problems. So don't touch them. Find an adult, again, and call 911. For so many of these things that we've talked about, for somebody who's choking, for somebody who's getting electrical shock, for somebody who's hurt their ankle or hurt their leg, what do? Find an adult, call 911. Find an adult and call 911. That's what you need to remember. When someone is unconscious, Whether he is breathing or not, it is a first aid emergency. Then conscious means they're not waking up. You're like, hey, hey, and they're not fooling around and playing. They're seriously knocked out. That's a first aid emergency. The first thing to do is find an adult and call 911. If the person is breathing, stay with them until help arrives. If the person is not breathing, an adult, okay, should form CPR, should start CPR. CPR is necessary to keep the person's heart beating until help arrives. During CPR, an adult will put his hands together, one on top of the other, and push hard and fast in the middle of a person's chest until help arrives. CPR is for first aid emergencies only. You should never be practicing on a friend. Even we as teachers, we have to go through CPR training. And when we go through our CPR training, a nurse comes in and she brings in a CPR dummy doll for us to practice on. Some dummy dolls, there's different sizes, but we practice on those, not on each other, because that can be very dangerous, okay? First aid is meant to help people in need. When a first aid situation happens, the most important things to remember are to stay calm. So many times people are just flailing around and they're crazy, and the first aid helper, the 911 operator, can't help because she doesn't even understand what you're saying and what's going on. So stay calm, find help, and then call 911. Ask God to help the injured person and those who are providing the help for them. So Psalm 46:1 says, God is our refuge and strength, a very present help in trouble. He's there. He knows. He cares. So rely and trust on him. And then you've got your comprehension check at the bottom of the page. We'll review over that and go over the answers tomorrow, so you don't need to turn it in or send it in to me. Your parents don't have to take a picture of it, because we will go over the answers tomorrow, but make sure you have filled them in today so that when we go over it tomorrow, it's just going to be, oh, did I get this correct or did I not? And then remembering and seeing why you didn't get it correct if you didn't, okay? So that is it, and that's the end of your what you need to know before we have our test on Thursday. So pages 55 to 78, be studying that carefully and going back through quizzes and different things that you might have taken already. The comprehension checks, bold print words, terms to remember, all of that will help you to be prepared for your test. All right, we will see you in the next video. See you soon.